Kia ora, New Zealand. I'm Angela, and I'm a medical doctor here to give you some tips on how you can support your mate or loved one with their mental health challenges. Make sure that the space is private and that you have enough time to have this conversation, because the last thing you want to do is when your mate starts opening up to you, you decide that you have to head off. The other thing is these conversations actually can be quite intense. So doing something at the same time takes a little bit of that pressure off. So you could suggest going for a walk, going for a drive, and even shooting hoops with the bro. Often we live these perfect lives on social media, and actually by being vulnerable and making people feel that you're going through challenges as well, it becomes that you are more relatable and they're more likely to then feel that you would understand what they're going through because, hey, you've gone through it yourself. Having made it now clear that you're willing to share and listen, the next step is really to ask permission to have this difficult conversation. And it can be as simple as, in a very caring way, saying, "Hey Sarah, I noticed that you're not your usual self. I'm a bit worried about you. Do you want to talk about it?" Also make sure that you allow them to say no, because sometimes you just might not be the right person for them to speak to, or that they just might not be ready yet. Often when people are talking to you, they're going to trigger thoughts in your head that you want to respond with. And you're going to have all these great ideas on how you're going to solve their problems for them. Don't do that. The most important thing for you to do now is just to listen and be present with them. Now, it's normal when having these challenging conversations that the people that you care about might actually bring up thoughts that they feel that there's no reason to keep living anymore. The most important thing is keep calm. If you're worried that they are going to act on those suicidal thoughts immediately or they have a plan, just call 111 or bring them to the nearest emergency department. Otherwise, it's actually really helpful for them to be able to talk through their suicidal thoughts without feeling judged or you going into panic mode, and actually just allowing them to understand that having suicidal thoughts is a normal part of coping with what they're going through. That's as simple as asking them to see their GP or a therapist. Often, that first step is really hard. So what you can do is help them with booking the appointment or suggest attending the first appointment with them if they would like that. Having these tough conversations can be really confronting for some people. And at that point in time, it can actually feel like it's made things worse. So the most important thing that you can do is just send a message later on to check in with them. Often when people are going through these dark patches, they can feel like nobody understands, nobody's there for them, that no one cares or want to help them. And having that check-in is a really important step to make people feel that they are not alone and that you are there for them. Ask your mate around what is it that they love doing or that they used to enjoy doing. By doing that, you plant a seed that helps people understand that they do have things that they can look forward to, or that there is something that they can go do after this conversation they have with you.